I'm just thinking about being the nurse or the doc, and it must be so disheartening to know what somebody needs and not be able to provide it. I remember in my ED and paramedic days where I'd opened my jump kit or the crash cart and something would be missing.
Yeah.
And I could deal with whatever came through the door. But when I was missing an important tool,
Yeah.
that really threw me for a loop,
Yeah.
really emotionally
Yeah.
got me.
Yeah.
And it seems like you guys are dealing with that day in and day out, like
Yeah.
knowing what you need to do and not having the tools to do it. That's just must be like, how do you stay yourself sane
Yeah.
in that wildness?
Yeah, it's just hit it exactly on the head, which is that the thing that I don't think we're accounting for, at least we now are beginning to understand more about it, at least at our facility at Boston, the the toll that it takes on providers is actually substantial. And it's exactly what you're saying, which is we know we aren't the right place for these patients. We're not doing the best things for them, right? Nobody thinks the best thing for you if you're suicidal is to sit in a dark ER room by yourself with no phone or no contact for 2 weeks. Nobody thinks that's the right solution. And we don't,
Solitary
nobody.
confinement.
Yeah, it's, and we, again, it's caught us off guard a little bit. I think we've tried to add some things and some
Mhm.
therapy options, and we're trying to do this stuff, but it's also in the setting of you're trying to do that amidst all of these sick patients medically who need
Right.
attention and acuity and all this other things. And I do think you're so right that it definitely takes a toll on people when you feel like, or when you're restraining a child, you're having to give them medication involuntarily or hold them down because they're aggressive. And in some ways, you're concerned that your environment is triggering that, and yet you
Mhm.
continue to have them in that environment. That's a really upsetting thing for people. And I do think it's caused a lot of, we've had a ton of nursing turnover, not just here, nationally. And I do think that is part of it. I think
Mhm.
people feel like we're not doing the best we can for these patients, and it's
Mhm.
really hard to be a part of that and watch it. I
Yeah.
think the other alternative is you can try to make it better, and that's what we're doing. But there's
Right.
no doubt that it sits hard with us.